Recording or am I awesome.
The record button has been pushed now, so you should be all set.
Well, again, I'm going to welcome everyone now that the recording button has been pushed. Welcome again, and thank you so much for joining in and listening to our presentation on launching the Community Resource Center at the Houston Public Library, where we provide resources, information, and referral services. Today's presentation will focus on the structure of Houston Public Library's Community Resource Center and its overall goals and objectives. I want to acknowledge and give thanks to Library 2.0 for granting Joy, Brade, and myself the opportunity to speak in this forum. I also want to extend a special thank you to our Director of the Houston Public Library System, Dr. Rhea Lawson, for being such a supportive person of this vision that we've had. So again, good afternoon. My name is Garrette Smith, and I am the Chief of the Central Library here, part of the Houston Public Library. The Central Library, which is Houston's Public Library's flagship location, is in the heart of downtown Houston, where we serve a very diverse community. Now, when we reopened in September of last year due to COVID, our newly reimagined Central Library was very excited about our updates to not only our spaces, but also our services, one of which is our Community Resource Center. This center was reimagined in how we engage and serve Houstonians, particularly those that are in search of social services. So in November of 2021, I was able to hire Joy Brade to lead this reimagined service model and its team. And so I will pass the mic to Joy. Joy?
Thank you, Garrett. And hello, everyone. I am very honored to be here today at Library 2.0 to share our goals and mission for CRC. I will begin by telling you a little bit about myself. I am currently in the position of the Senior Community Liaison here at the Houston Public Library. I am extremely passionate about social services, mainly because I have been in the position to witness the incredible and positive effects it has had on people's lives. I began my career in social service field when I started working at Help USA in New York City. There, I worked with survivors of domestic violence in various roles within the agency. Within all of my roles actually, the focus was primarily to link individuals to services to foster empowerment and to rebuild their lives. I later moved on to be a program coordinator, assisting people who were formerly incarcerated transition from Rikers Island into the community to move towards family reunification. Today, I will share with you the outline of our presentation. I will be discussing an overview of social services and talking about the benefits to the community. I will explain our mission and vision of the Community Resource Center and how we were able to identify the demographics that we serve. I will give an outline of the strategic plan for CRC and some of our accomplishments that we've had since we began. I will also share the future goals of our team. HPL Community Resource Center team is a small team within the Houston Public Library that aims to connect its customers to trusted social services within the community. For the purpose of this presentation, I think it's very important that we define social services. I am sure many of you are familiar with social services or familiar with the term social services, or maybe some of you have even benefited from a social service agency within your community. We have the definition on the slide. Social services can be defined as any program designed to help people resolve problems, become more self-sufficient, strengthen family relationships, and/or enhance the functioning of individuals in society. There are a variety of social services entities across the country, as we are fully aware. Social services include, but are not limited to, the programs in these general categories. We have housing services, and one of the most common housing services, we have Section 8 rental vouchers. We also have healthcare services. We have social services that provide mental health support. We also have social services that provide disability assistance. We have food assistance also. Most commonly, we have food stamps, EBT. All of these are categorized under social services. Any one of these programs can be provided by either the government or a private entity or a non-for-profit agency. Now, social services is undeniably beneficial to the community in many ways. Here, I have listed 3 of the main benefits of social services to the community. It aids in promoting successful social functioning of individuals. And by social functioning, we're talking about the person's ability to engage effectively in any social interaction. It could be engaged at work or at home, or anything that would be able to assist someone in conducting everyday life independently. A typical example could be a social service agency providing mental health support for a mother who may be suffering from a mental health decline. After receiving those services, it would enable that mother to carry on her daily lives and her daily function in taking care of her kids and the family. Another benefit of social services is to provide support for overwhelming challenges. And we have several overwhelming challenges. Some examples could be homelessness, mental health challenges, or medical challenges or financial challenges. In general, social services aid in promoting a higher quality of life for the underserved and disadvantaged population within a community. We live in a changing community. In response to the changing needs of patrons and communities, libraries are continuing to innovate ways to meet the varied psychosocial needs of patrons. For that reason, the Houston Public Library has focused on opportunities to connect its patrons to its needed social services. This is where HPL Community Resource Center team comes in. And here we have a beautiful picture of the team. This is an actual picture of the team that we have here at HPL. HPL Community Resource Center is a unique service model here at the central location. It's unique because of its prime focus of integrating social services into the library system. The HPL Community Resource Center team comprises of 7 staff members, including myself. All staff members function within their role of HPL. However, they provide aid to the Community Resource Center. Staff members assist in building the bridge between our customers and community providers. And just like every community provider or agency, there is a vision and a mission, and we wanted to have that also so that we could stay true and focus on our purpose here. Our team holds the mission of linking people to resources, information, and referral services. And our vision is to serve as a clearinghouse of information to improve the quality of life of our customers. The overall goal of HPL Community Resource Center is to be a hub to all Houstonians. We want, as much as possible, to foster that positive connection with community resources that can effectively address the needs of our changing community. We also would like to have this program piloted in our neighboring libraries where it is identified to be needed the most. Now, what does the team do on a daily basis? What are the daily functions of the team? On an average day, the team members can be found roaming the floors, participating in floor engagements, where the central focus is on building relationships. Team members are also committed to programming, where they put together activities to keep our customers engaged. You will also find our team members engaged in telephone outreach. They would reach out to community agencies to verify services and referral procedures, just so that we have everything accurate when we provide that information. With social services, some of the services are forever changing. Grants change, services change. So the team members are assigned service categories. The aim is to maintain the connections with the community entities that provide those services. So how did we embark on HPL Community Resource Center? When I began my role as the Senior Community Liaison, I dedicated the first 60 days to assessing the needs, the tools, and the resources. I spent a lot of time on the floor making connections with customers coming in, welcoming them into the library, and also engaging conversations directed to their service needs. During my time spent engaging with customers, I was able to gather a lot of information on the various challenges that they face in their daily lives, also the challenges that they experienced in navigating the resource system here in Houston. I wanted to know more about the resource system that we had in place here at our central location, which was the resource guide. This was a catalog of social service agencies and providers within the community. I then began doing my own research in social services in other large libraries. I wanted to understand what social service models were used and how they were implemented. I found out that each library system, they were able to find what program they wanted and based on their overall needs, and they implemented it and tailored it to fit the needs of their library system. Lastly, due to the large number of on-house population that we attract, my assessment led me to take a closer look into the resources that we were utilizing when they visited the library. How were they benefiting from those resources that they tapped into? And what challenges that they were experiencing when utilizing those resources? With the wealth of information gathered, we now needed to select what model would work best for the needs here at our central location. However, before we proceeded, we needed to decide what area or population that was deemed had the greatest need. After identifying that population, we needed to figure out how best to work with that population. It was clear that our central location attracts many of the unhoused population. I observed that it was also strategically located near many of the prime social entities, such as the Beacon, Loaves of Fishes, Coalition of the Homeless. All of these entities provide a variety of social service support to the unhoused. However, none of them were equipped to engage them or fully engage them throughout the day if they were not successfully housed. So it was safe to say that our central location fills in the gap for this community. It was the only entity that allowed accommodation to utilize resources during the day completely free of charge. And we're usually open 6 days a week. We also looked into one of the most recent studies by the Coalition of Homeless that was done in March of 2021. And according to that study, close to 3,055 individuals experience homelessness on any given day. Now, when we took a closer look into that survey, that study and the population, we saw that the results indicated that 38% of that population suffer from mental illness. Also, 32 suffer from substance abuse, while we had 29 were US vets, 15% were victims of domestic violence. And we had an overwhelming 49% experiencing multiple barriers of housing, or for housing, I should say. For that reason, we decided that since we're dealing with a population, such a large population with so many needs, it was very important that we approach it in a particular way that we would provide the most needed services. We decided that we were going to customize our service model to fit the needs of our customers. I remember reading an article from Kristen Lambert, who was a licensed social worker. The article was entitled "Libraries and Social Workers' Perfect Partner." She quoted in that article that accessing and utilizing resources in a library connotates the strength and intelligence, unlike the stigma associated with seeking help in other environments. She went on to explain that people feel more comfortable seeking information in the library, hence the importance of always having available updated resources. This leads us to our resource guide. This was the existing tool that we had here at our central location. It was a great tool. However, since COVID, and so many social service agencies changing their services and their way of providing services, we decided that we wanted to reimagine the resource guide. We envisioned our resource guide to be one that would have updated information, new direct service categories, and we wanted to make it accessible not just for the team, but for all the staff members. The team and we then went forth in updating the information about the service providers, new categories. We added new categories such as veteran services, LGBTQ, youths and adolescents, HIV and AIDS, substance abuse. We no longer wanted to provide a cookie cutter referral, but we wanted to have an individualized referral that would fit the needs and services of our customers. Our goal is to have the resource guide accessible on the intranet. We are currently working with other departments to have this guide, this resource guide, accessible to all staff members. Now, essential training. It's very important that we are all trained and staff continually get the training needed. Training is fundamental in assisting staff in navigating and effectively responding to issues when interacting with the people experiencing homelessness. We recognize the need and we decided that we would partner with trusted agencies within the community that have the experience of working with the vulnerable population. And some of the areas of focus for training are as follows. We have the mental health training, we have sensitivity training, active engagement training, and crisis intervention trainings.
Now, before reopening on September the 8th, the Central Library was tasked with providing a robust and diverse set of programs. CRC, we've been using Community Resource Center, but we love to use acronyms here at Houston Public Library. But CRC really stepped up to the plate in this task. And so Joy is definitely going to share with you some of the services and programs that the team has created and provided to the community. Joy?
Okay, to initiate those services, we decided to host an open house event. The overall goal of the open house was to introduce our patrons to the team, let them put the face to a name, and promote the services that we were going to offer, and also to direct them to the CRC room. We had the open house and it was very engaging. The patrons were participating in all the activities. We also gave them an opportunity to give suggestions of services that they would like to connect with, and also programs that they would like to see here at our library. We divided our overall services into 4 main categories. We have one-on-one assistance, we have referral services, and we also have information sessions. And one of the information sessions that I would really like to highlight was the coffee and conversation with a therapist. That's where we were able to provide a small glass of coffee while the patrons were able to come into the CRC room and speak one-on-one with a therapist, and they would be able to find out how they would be able to receive services from that agency. And that was one of our successful information sessions that we have. We also have programs that we provide to our customers. Another one of our accomplishments was the mental health fair. That was done on May the 21st. Mental Health Month was May, so we took the opportunity to let our customers know that the library is a safe and welcoming place, and we all have providers within the community that provide mental health services. So we wanted to highlight that. On that day, we had over 3,000 visitors, which took part in our fun family activities. We also had a local author who spoke about mental health and his new book, thanks to the collaboration with system-wide programming. We had 8 informational booths and a lot of fun activities such as yoga and art activities for all ages. We were also able to collaborate with communication departments in advertising these events. We were able to create a PSA, and we posted it on TikTok and on IG so that we will let all our customers know that we were having this event on that day. One of the great highlights of that day was our partnership with VaxU. VaxU is an agency that provides vaccination and boosters, and they were able to vaccinate 17 of our patrons, many of which were from the unhoused population, and that served as a gateway so that the unhoused population would be able to gain entrance into shelter. Here at Houston, most of the shelters require customers to be vaccinated. So that was one of the things that we really was happy about. Okay, and one of our success stories, we also wanted to share one of our success stories. We have Tony. Tony is a 64-year-old Hispanic male who lived with his wife for over 30 years. Within a 6-month period, Tony's life took a turn for the worse. His wife fell terribly ill and eventually passed away. Tony, crippled in debt and depression, was not able to keep up with the rising cost of living and no support. Tony was now homeless. He ventured out from San Antonio to Houston in hope of reconnecting with support and rebuilding his life. Tony's arrival to Houston led him to the Houston Public Library. Together, we were able to determine Tony's immediate need for shelter. Tony expressed his willingness to be connected to shelter and to be linked with services for his depression. After several calls, Tony was able to complete an assessment over the phone and was admitted into shelter. Tony was overjoyed for his new connection. Now, what's on the horizon for CRC? We are planning a job readiness workshop at the beginning of 2023. These workshops will be conducted in collaboration with the Career Education and Business team alongside Cafe College in preparation for the upcoming job fair for the unhoused and the low socioeconomic population. We are also heavily focused on outreach and inreach. Part of the outreach is that we want to focus on some of the shelters within the community, and would like to bring the library services to the shelters so that we can let everyone know about the services and the programs that we have here at our library. We also like to plan a system or put a system in place where we can support our neighboring libraries dealing with the unhoused population. I know that that support will definitely go a long way. And to close, I would like to leave with you a quote that says, "Somewhere along the way, we must learn that there is nothing greater than to do something for others." And this quote is quoted by Martin Luther King Jr. Below, I have also listed my contact information for anyone who would like to ask any questions or have any comments or would like any directions as it relates to what we presented here today. Thank you so much for listening. I am not too sure if time permits, if we are able to take some questions, if there are any.
I know that there were a couple questions in the chat, and I don't know if everyone was privy to the answers, but Patty Wong asked a question. She stated, what a great program. How are you funded, and what kind of metrics do you use to evaluate your effectiveness? Do you have connections also with 211? So I answered, Patty, one of the questions, but I'll elaborate on a few others. We were fortunate enough not to have additional funding for this extended service model. What we did do, we moved some positions around within the central library so that the Community Resource Center had the resources, individuals that it needed to do not only outreach, but inreach. I do want to also share that our Friends of the Library, as well as our foundation, heavily supports the library as a whole. And so we do receive some fundings for programs or special programs based off of the need for that funding. As it relates to metrics, this is still a new service model. We are putting together right now some metrics, but I'm quite sure if you take down Joy's information, we are a system that believes in sharing. Sharing is caring. And so we can definitely keep you or anyone else interested in how we evaluate our effectiveness. Right now, we have in place, we use something called, what is it? What's the statistical software? Yes, Ref Tracker. Thank you. Ref Tracker. And so Ref Tracker has a built-in called Desk Stats. We have customized that area to where Joy and her team are able to input statistics related to those categories that she shared earlier. And so we are able to really track to see what are the customers really asking for. Are they asking for housing assistance? We're able to kind of keep track not only of what they're asking for, but at what time. And so one example of that is when Houston experienced a cold front in February. It dropped. Many people may not feel it, it was cold here at Central if you live in other parts of the United States, but it posed a danger to our unhoused customers. So when we look at those type of things, when we keep track of what the weather is like, what were the questions asked that particular day because of the cold chill, many of the questions were, where can I get housing, for shelters, which shelters aren't full, how can I get transportation? And so a lot of things that are happening in our society definitely has a ripple effect on the questions that many of our people seeking social services or just assistance is based off of. So I know that was like a pretty long answer, but again, we are definitely willing and able to share additional information. Other questions, let me see. Mary Bird asks, have you been able to partner with community resources to help patrons navigate these often difficult systems? I often get feedback from patrons that they had issues getting services they need. And I'll pass the mic to Joy just briefly, but one thing that I want to share with everyone is that the reason we wanted to implement this here at the Central Library, not only because we are the flagship of the organization, but because we do see such a diverse socioeconomic as well as just diverse community. And so we all know working in libraries, we want to serve. We wear many hats. We want to be able to give the answers, but there are experts out there that you can partner with that can give direct support to our customers. So we wanted to create an environment where we're not sending a customer, three blocks down from the library to the right to try to see if they can get shelter. We want to bring those experts into the library so that they have a direct contact with an individual or an organization so that they can receive that service automatically or get the ball rolling on those services. And so we've kind of taken a step back. We've built that network that will help our Houstonians achieve a better quality of life. But we've made those connections so that the experts can assist them with that.
Yes, and just to piggyback of what Garrett was saying, a lot of our in-house population, they experience a lot of trust and mistrust and distrust with some social service agencies. So what we try to do is we continuously have options in place. So when we're partnering, we don't partner with just one healthcare service provider. We partner with several. So with that being said, when we invite them into the library, we kind of like sit in and provide that additional support if they have any questions that sometimes they don't want to ask. We assist them in, we try to empower them in asking those questions for them, or being just a support system, with them. We also target a lot of agencies that provide case management. And with a case manager, a lot of our customers are able to get that full comprehensive care. A case manager is designed or has a role of helping them or guiding them along the line of getting those referrals and monitoring them when they actually participate in those services. So connecting them to case management services would be one of the best options too.
Awesome. I'm just kind of answering some questions in the thread. I know that Diane asked, do we work with 211? And so that is, Joy, I know that's on your to-do list. I'll just plug in my chief aspect. I know that Houston Public Library isn't unique in this fact, but our staffing levels aren't where they need to be. And it's the great resignation. We weren't, exempt from that space. And so right now, to make sure that we are doing more of an efficient type of service for our customers, we haven't tackled all of the things that we want to do. We don't have all of the partnerships that we want, but that is on our list, Diane, in terms of being and working with 211 so that we can better serve our Houstonians. I think, Megan, are we out of time? Other questions?
I think we can go ahead and stop the recording because I know we're a few minutes over time, and I just want to honor everybody's time today. Thank you again to all of our presenters. We really appreciate it. This is so interesting to listen to and learn a little bit more about. And thank you for being so willing to share in this session, and then also with so many other resources with contact information.
Thank you for the invite. Have a good day, everyone.
Bye, everybody.
Bye-bye.